Hi everyone, welcome back to your channel I Love Pharmacology. In this session, let us learn about drug-induced osteoporosis, means drugs which can increase the risk of fracture. And also let us learn about drugs to treat osteoporosis. So coming to the drugs which can induce bone loss or which can increase the risk of fracture. So you have a list of drugs you need to remember, because these are the drugs which you need to be avoided in case of elderly individuals who are more prone for osteoporosis as well as risk of bone fractures, like aluminum antacids, anticonvulsants like phenytoin, aromatase inhibitors which are used in the treatment of breast cancers, furosemide which is a diuretic which loses the calcium, glucocorticosteroids or glucocorticoids, heparin, medroxyprogesterone acetate, proton pump inhibitors, selective serotonin reuptake inhibitors, and the thiazolidinediones, that is the rosiglitazone and pioglitazone, which are used in the treatment of diabetes mellitus. And also one should remember that excessive replacement of the thyroid can lead to loss of bone. So next, let us understand what are the drugs which are available for the treatment of osteoporosis. Means these are the drugs which can reduce the loss of the bone or which can prevent the disease progression. So we have a hormone replacement therapy, that is hormonal regulation of calcium and phosphate homeostasis. We have a calcitonin, parathyroid hormone derivative like teriparatide. We have a vitamin D supplementation. We have a hormone replacement therapy. And second group, we have an anti-resorptive agent. These are the agent which prevents the resorption of the bone, thereby there won't be any increased loss of the calcium or the bone, and there won't be any increase in the calcium levels in the plasma blood levels. So basically it will prevent the reabsorption or loss of bone from the bone. So we have a bisphosphonates. Under bisphosphonates you have got abaloparatide, alendronate, ibandronate, residronate, and zoledronic acid or zoledronate. Under biological drugs, which are the monoclonal antibody, we have a denosumab which can be used to treat the osteoporosis. And third group is the drugs for disorders of bone remodeling. We have a etidronate, pamidronate, and telidronate. Again, these belongs to bisphosphonates. And next group, we have a selective estrogen receptor modulators like raloxifene. So next, let us understand how to prevent the osteoporosis. Basically, you need to reduce the loss of bone in case of, particularly in case of postmenopausal women, and you need to ask for proper or adequate dietary intake of calcium as well as the vitamin D, which are very, very important. And also along with that, one has to go for weight bearing exercises to strengthen the tone of the muscle, which can hold the bone as well as the ligaments, so that thereby it increases the strength of the bone in terms of mobility. And also one should avoid smoking and also avoid excessive intake of the alcohol, which has a direct impact on the loss of the bone and the osteoporosis risk. And if there is inadequate dietary intake of calcium, they need to go for the supplementation, since the dietary requirement is not providing the adequate amount of the calcium. So in such cases, the individual has to receive a calcium supplementation in the form of calcium injections or the calcium tablets, etc. So under this, we have example like calcium carbonate can be given, which is commonly used, which has got 40% of the elemental iron, and these calcium carbonate should be taken with meal because of the increased risk of gastritis, and also there is a better absorption. Whereas in case of calcium citrate, which has got 21% of the elemental calcium, it is better tolerated when compared to the calcium carbonate, but it can be taken with or without food. The adverse effect which you can encounter on calcium supplementation is the person may feel bloated or gas sensation. And cautious thing which you need to take care is, whenever the patient or individual takes a calcium as a supplementation, there are many things you need to remember regarding the drug interactions. So calcium may interfere with the absorption of the iron preparations if the person is suffering from the iron deficiency anemia, and if you have prescribed the iron tablets and along with that you also giving the calcium supplementation, calcium may hinder the absorption of the iron supplementation. And also calcium may interfere with the thyroid replacement, and also the calcium may decrease the serum or the adequate concentration of fluoroquinolones as well as tetracycline in the blood. So please remember, calcium should never be given if the patient is taking iron preparation, thyroid replacement, or the fluoroquinolones or tetracycline. If you want to give these medications, you need to follow one rule, that there should be a gap of at least 2 to 3 hours between the administration of calcium and these preparations. So administration should be separated by several hours to prevent the interaction, that is, these calcium will not going to interfere with the absorption of these drugs if you properly administer at a separate interval of time. So how to prevent the osteoporosis? One is you have given a calcium supplementation. One more thing you need to do is you need to give a vitamin D supplementation as well, which is essential for you may thinking why vitamin D, already calcium is given as a supplementation, because vitamin D has got a very important role in terms of the absorption of the calcium. So vitamin D is essential for absorption of the calcium, which maintains the bone health. So especially the older patient and particularly the menopausal individuals are often at a risk of vitamin D deficiency. So they need to go for supplementation like vitamin D2, that is ergocalciferol, or vitamin D3, that is cholecalciferol. So which are the drugs that needs to be avoided if a patient is at risk for osteoporosis? So in the previous slide you have learned about the drugs which needs to be avoided, like the antacid preparations, proton pump inhibitors like anticonvulsants like heparin and glucocorticosteroids, etc. So basically you need to remember there is an increased bone loss, especially with respect to the glucocorticosteroids, which are abused nowadays. And use of glucocorticosteroids, when it is not used properly and for a particular period of time, it can lead to loss of bone. So example is prednisolone 5 mg per day or equivalent is given, and if it is not used for a short duration of time, and these drugs, if it is continued for 3 months or more continuously, there is a significant risk factor which is involved, which can increase the development of osteoporosis in an individuals who are regularly abusing the glucocorticosteroids. So at the end of this class, what you need to remember is, at least you need to remember this slide, that is the drugs which can induce fracture risk or osteoporosis. If you need to remember one drug, please remember it is glucocorticosteroids is the one drug which will definitely lead to osteoporosis if it is abused or if it is used continuously for more than 3 months. And drugs which are useful for treatment of osteoporosis, for a basic osteoporosis or a mild osteoporosis, is your calcium supplementation and vitamin D supplementation. So this was all about the class regarding the drugs which can cause osteoporosis and drugs to treat the osteoporosis. In the upcoming class, let us learn about the other group of drugs which are used in the treatment of osteoporosis, like bisphosphonate, denosumab, and other drugs which are useful in the treatment of osteoporosis like raloxifene, etc. So if you find this video useful, please do subscribe to our channel I Love Pharmacology for more updates on pharmacology. Thank you.